Semaglutide, Wegovy, a new treatment for weight loss. 20-minute drug review. Hi everyone, and welcome to a special edition of the PharmEasy Tutor. Today I'll be spotlighting the use of semaglutide for weight loss. This will be a concise review that hopefully will provide you with everything you'll need to know about the drug. Semaglutide is approved as a weight management drug for the treatment of obesity under the brand name Wegovy. Wegovy is manufactured by Novo Nordisk. Semaglutide is a synthetic version of a gut hormone called GLP-1 that suppresses hunger and appetite. It's given as a once-a-week injection subcutaneously under the skin. Semaglutide at a lower dose of 1 milligram was first approved by the FDA to help control blood sugar in the treatment of type 2 diabetes in 2017 under the brand name Ozempic. You can see in the table that Ozempic and Wegovy are the same drug, semaglutide. However, the indications are different in that Ozempic is used for type 2 diabetes and Wegovy is used for weight loss. Also, the dosages are different, where Wegovy is used at a higher dose. In the United States, over 70% of adults have obesity or are overweight. 1 out of 3 adults, over 100 million people, have obesity. Treating obesity can improve blood pressure, blood sugar, and cholesterol levels, but less than 3% currently receive anti-obesity medications. Semaglutide is the first drug for chronic weight management that has been approved by the FDA since 2014. You can see in the table that Novo Nordisk has another weight loss drug named liraglutide or Saxenda, which was approved in 2014. It has the same mechanism of action as semaglutide. However, liraglutide requires daily administration, whereas semaglutide is given weekly. And also the impact on body weight loss for liraglutide is 5 to 8%, which is much less than the body weight loss achieved by semaglutide, which is 15%. Semaglutide is indicated for chronic weight management in adult patients with an initial body mass index, or BMI, of greater than or equal to 30, obesity, or an initial body mass index, BMI, of greater than or equal to 27, which is an overweight condition, in the presence of at least one weight-related comorbid condition, for example, hypertension, type 2 diabetes, or dyslipidemia. BMI can be calculated by dividing the weight in kilograms by the height in meters squared. Tables such as these are readily available to easily calculate a patient's BMI. If the value falls in the darkened area, the patient is overweight. If the BMI value falls in the lightly shaded area, they are obese. Semaglutide should be used in combination with lifestyle changes, including a healthy diet, reduced calorie intake, and increased physical activity and exercise. Semaglutide should not be used in combination with any other semaglutide-containing products or any other GLP-1 receptor agonists. Avoid using semaglutide with other products intended for weight loss, including prescription drugs, over-the-counter drugs, and herbal preparations. The safety and efficacy of co-administration with other products for weight loss has not been established. Semaglutide is an injectable glucagon-like peptide 1, GLP-1, receptor agonist. Semaglutide is a synthetic version of a naturally occurring hormone in the gut named glucagon-like peptide, or GLP-1. GLP-1 is an incretin hormone that plays a role in appetite and digestion. Incretin hormones are released by the small intestine and are sent out after eating a meal to help lower blood sugar by triggering insulin and blocking other sources of sugar. It also slows down how quickly food leaves the stomach, called gastric emptying. GLP-1 receptors are present in several areas of the brain involved in appetite regulation. Semaglutide works by mimicking GLP-1, targeting and activating receptors in the brain that regulate appetite and control hunger. It slows gastric emptying, promoting a feeling of fullness called satiety by acting on receptors in the brainstem and hypothalamus. These actions cause a feeling of fullness sooner, reducing appetite and causing weight loss by eating less. In the figure, you can see how the stomach is communicating with the brain, telling it that it is full. The brain gives a thumbs up, telling the body to stop eating. Semaglutide lowers body weight through decreased calorie intake. The effects are likely mediated by affecting appetite. As with other GLP-1 receptor agonists, semaglutide stimulates insulin secretion and reduces glucagon secretion in a glucose-dependent manner. These effects can lead to a reduction of blood glucose. Semaglutide is available as a single-use injection pen. The dose is already preset, and the pen is discarded after the shot. Administer the drug once a week, on the same day each week, at any time of the day, with or without meals. Inject subcutaneously in the abdomen, thigh, or upper arm. Avoid injecting the medication into the identical spot every time. Dosage. Start at 0.25 milligrams once a week for 4 weeks. In 4-week intervals, increase the dose until a dose of 2.4 milligrams is reached. Follow the dose escalation schedule in the table to minimize gastrointestinal adverse reactions. The maintenance dose of semaglutide is 2.4 milligrams once a week. Semaglutide is available in 5 different strengths required for dose escalation. Each strength comes in a box of 4 pens. Here are the instructions if a patient misses a dose. This information can be located in the package insert. Store the semaglutide pen in the refrigerator between 2 to 8 degrees centigrade. If needed, before removing the pen cap, semaglutide can be stored at room temperature in the original carton for up to 28 days. Keep the pens in the original carton to protect it from light. Do not freeze the pens. No dose adjustment of semaglutide is recommended for patients with renal or hepatic impairment. In a study of subjects with renal impairment, including end-stage renal disease, no clinically relevant change in semaglutide pharmacokinetics were observed. In a study in subjects with different degrees of hepatic impairment, no clinically relevant change in semaglutide pharmacokinetics was observed. Instructions on how to use the Wegovy pen. The Wegovy pen is for one-time subcutaneous under-the-skin use only. The dose is already set on the pen. Step 1 is to choose your injection site. You may inject in your upper legs, the front of the thighs, or lower stomach. Another person may give the injection in the upper arm. You may inject in the same body area each week, but make sure it is not the same spot each time. Do not inject into an area where the skin is tender, bruised, red, or hard. Step 2. Wash your hands. Clean the injection site with an alcohol swab or soap and water. Do not touch the injection site after cleaning. Step 3 is to remove the pen cap. Pull the pen cap straight off of your pen as illustrated. Step 4 is to inject the drug. Push the pen firmly against your skin until the yellow bar has stopped moving. If the yellow bar does not move, press the pen more firmly against your skin. You'll hear 2 clicks during the injection. Click 1, the injection has started. Click 2, the injection is ongoing. Do not remove the pen from your skin before the yellow bar in the pen window has stopped moving. If the needle is removed earlier, you may not get your full dose of Wegovy. The needle cover will lock when the pen is removed from your skin. You cannot stop the injection and restart it later. Put the used Wegovy pen in an FDA-cleared sharps disposal container right away after use. Do not throw away the pen in your household trash. When your sharps container is almost full, you'll need to follow your community guidelines for the right way to dispose of your sharps container. Refer to the FDA's website at fda.gov, Safe Sharps Disposal. And to find specific disposal locations in your area, go to safeneedledisposal.org. Let's move on and talk about the kinetics of semaglutide. The absolute bioavailability of the drug is 89%. The maximum concentration of semaglutide is reached 1 to 3 days post-dose. Similar exposure was achieved with subcutaneous administration of the drug in the abdomen, thigh, or upper arm. The mean volume distribution of semaglutide is approximately 12.5 liters. Semaglutide is extensively bound to plasma albumin, greater than 99%, which results in decreased renal clearance and protection from degradation. The primary route of elimination for semaglutide is metabolism following proteolytic cleavage of the peptide backbone and sequential beta oxidation of the fatty acid side chain. The clearance of semaglutide is approximately 0.05 liter per hour. The elimination half-life is approximately 1 week. Semaglutide is present in the circulation for about 5 to 7 weeks after the last dose of 2.4 milligrams. The primary excretion routes of semaglutide-related material are via the urine and feces. Approximately 3% of the dose is excreted in the urine as intact semaglutide. Drug interactions: insulin and drugs that cause insulin secretion. Hypoglycemia: semaglutide can lower blood sugar and cause hypoglycemia. In patients with type 2 diabetes, semaglutide caused hypoglycemia in 6.2% of patients, compared to 2.5% given placebo. Concomitant use with insulin or drugs that can cause insulin secretion, like sulfonylureas, may increase the risk of hypoglycemia. Reduction of the dose of insulin or sulfonylurea may be necessary. Inform all patients of the risk of hypoglycemia and educate them on the monitoring for signs and symptoms of hypoglycemia. Drug interactions may also occur with oral medications because semaglutide delays gastric emptying and thereby has the potential to impact the absorption of concomitantly administered oral medications. Therefore, monitor the effects of oral medications that are used concomitantly with semaglutide. Contraindications. Semaglutide is contraindicated in patients with a personal or family history of medullary thyroid carcinoma, MTC, or in patients with multiple endocrine neoplasia syndrome type 2, MEN2. This risk of thyroid C-cell tumors is an FDA boxed warning. In rodents, semaglutide caused thyroid C-cell tumors at clinically relevant exposures. It's unknown whether semaglutide causes thyroid C-cell tumors, including medullary thyroid carcinoma in humans. Counsel patients regarding the potential risk for medullary thyroid carcinoma with the use of semaglutide and inform them of symptoms of thyroid tumors, that is, a mass in the neck, dysphagia, dyspnea, or persistent hoarseness. There are several warnings and precautions to be aware of with the use of semaglutide. Hypersensitivity. Anaphylactic reactions and angioedema have been reported post-marketing. Discontinue semaglutide if suspected. Acute pancreatitis has occurred in clinical trials. Discontinue promptly if pancreatitis is suspected. Semaglutide has not been studied in patients with a history of pancreatitis. Acute gallbladder disease has occurred in clinical trials. If cholelithiasis is suspected, gallbladder studies and clinical follow-up are indicated. Other warnings and precautions include acute kidney injury. Monitor renal function in patients who report severe adverse GI reactions or in those experiencing nausea, diarrhea, and/or vomiting leading to volume depletion and dehydration. Diabetic retinopathy has been reported in trials with semaglutide in patients with type 2 diabetes, 4% versus 2.7% placebo. Patients with a history of diabetic retinopathy should be monitored. Heart rate increases. Monitor the heart rate at regular intervals. And suicidal behavior and ideation, monitor for depression or suicidal thoughts, and discontinue semaglutide if these symptoms develop. The use of semaglutide in pregnancy may cause fetal harm. When pregnancy is recognized, discontinue semaglutide since weight loss offers no benefit to a pregnant patient. For females and males of reproductive potential, discontinue semaglutide at least 2 months before a planned pregnancy because of the long half-life of semaglutide. Lactation. There are no data on the presence of semaglutide or its metabolites in human milk, the effects on the breastfed infant, or the effects on milk production. The most common adverse reactions reported with semaglutide were nausea, diarrhea, vomiting, constipation, abdominal pain, and headache. Nausea occurred at a rate of 44% in semaglutide-treated patients, and diarrhea 30%. Fatigue, dyspepsia, dizziness, abdominal distension, burping, hypoglycemia in patients with type 2 diabetes, flatulence, gastroenteritis, and GERD also occurred. Since semaglutide slows down how quickly food leaves the stomach, patients may experience side effects like nausea and vomiting. The medication dose must be increased gradually over 16 to 20 weeks to 2.4 milligrams to reduce the GI side effects. These side effects typically resolve on their own. 6.8% of participants on semaglutide stopped taking the medication because of adverse reactions, compared to 3.2% of patients on placebo. Semaglutide was clinically studied in 3 randomized double-blind placebo-controlled trials involving over 2,000 patients. The patients were studied for 68 weeks. A 16-week dose escalation period was followed by 52 weeks of using a maintenance dose. The mean age of patients was 48 years old. 71% were women, 72% were white, 19% of patients had type 2 diabetes, and 28% of patients had a BMI greater than 40. In the largest clinical trial evaluating the safety and efficacy of semaglutide for weight loss, participants without diabetes who took semaglutide lost on average 14.9% of their initial body weight compared to those who received the placebo 2.4%. The difference of 12.4% was statistically significant. All patients received reduced calorie diet and increased physical activity counseling. In a clinical trial conducted in patients with type 2 diabetes who were overweight or obese, those who used semaglutide lost 9.6% of their body weight compared to 3.4% in those who received the placebo. Although the difference was smaller than the first study, it was also statistically significant. The third trial studied patients who also received more intensive diet and exercise therapy. The semaglutide-treated group in this trial had the greatest change in body weight from baseline, 16%. The difference from placebo of 10.3% was also statistically significant. In study number 1, 84% of patients using semaglutide lost 5% of body weight, 66% lost 10%, and almost half of the patients lost 15% of their body weight after 1 year. Compared to placebo, the overall difference was about 50%. The list price of Wegovy is expected to cost between $1,300 and $1,600 per month. This price is identical to Saxenda, a similar medication for weight loss made by the same company, which costs $1,349 a month without insurance. Here are some points of discussion to use when counseling patients on the use of semaglutide. All of the potential risks were discussed previously in this lecture. Here are some more patient counseling points of discussion. In summary, here's the bottom line. Semaglutide is a new FDA-approved injectable weight loss medication. It's safer and more effective than many other existing weight loss drugs. Clinical trial data suggests that semaglutide works better for treating obesity than any other previously approved drug. It takes a few months to reach the target dose, and side effects like nausea, vomiting, and diarrhea may occur. Compared to other medications on the market, it's expensive, with a monthly price tag of $1,300. The clinical benefit and safety profile of semaglutide may justify payers to reimburse the product as a medically necessary treatment for the obese population. Is semaglutide worth it? Well, I've given you a lot of information, but everyone needs to come up with their own decision. And while you're here, take a look at some of the other videos on my channel. Thanks for tuning in to watch this installment of the PharmEasy Tutor. I hope you learned something that you could use at school or in practice. If you'd like to continue to see more of these types of tutorials on YouTube, please make sure to click on the subscribe button below to change it from red to gray. Also, if you like this video, I would appreciate it if you can click on the thumbs up icon below to change the color to blue. If you have any comments or questions, please feel free to add them in the comments section below, or share this site with someone else. Stay tuned to the PharmEasy Tutor channel for more lectures in the upcoming weeks. So until next time, remember to take it easy.